So after the tests of function, we would move towards motion testing, and we want to see what the symptoms response to movement is. So let's go through just the logistics of it first, and then we'll talk about what we're looking for, what it means, etc. So we first want to make sure that we establish the baseline, that we know where the pain is and how serious it is. So we would ask the person, can you tell me where you're feeling your pain right now? Let's say he points to this area right here in his low back. And we would ask, can you rate that on a scale of 0 to 10? 0 is no pain at all, 10 is the worst pain you can imagine. And whatever he picks, we can say maybe a 3 or something right now. That's what he feels when at the baseline. So then, okay, we're gonna have you try to go through some movements to see what happens to that pain. Okay, is that all right with you?
Sure.
All right, can you sort of bend towards the floor as far as you're able to go? And then come on back up. What happened to those symptoms now? So we want to know, is there any change? Better, worse, the same? Is it the same location, same intensity? And if he says that it's at status quo, same, or better, we might ask him to do it again. Even so, the only thing we don't want is for any pain to travel further distally, especially jumping from one region to the next. So if he were to say, that caused pain in my calf when I did that, then we would stop and be done. But in the other cases, we would say, all right, what happens if you do it again? Can you do it again? And I would be standing directly behind him so that I can see what's happening as he moves. And then what happened to that now? Did that do anything to this pain that you were feeling? So if he says it's still about the same, we might have him do it a few more times. Can you do a few repetitions of that? Down and up? All right, so we'll talk more about how many you would do in a few minutes.
Okay.
So now we'll test motion into extension. Again, we need to establish the baseline because now we've done several repetitions of flexion and we want to start all over again. Say, okay, what's the pain that you're feeling now? Is it still right here? Say
Yes.
And what level would you give that? 0 to 10. You would pick a certain number. Okay. There's nothing further down in this area? No? Okay. All right, can you put your hands on your hips and arch backwards and come up to standing straight? What did that do to your pain? Did it change the location of the pain? Did it change the intensity? If it's all about status quo or improving it, then we ask him, can you do that a few more times? Back and up. Just try to arch from your back, come up, right? Not so much with your knees. Come back up. Good. So again, we'll talk about how many repetitions you do separately, because that will vary from one patient to another. Okay. So now we'll look at motion testing into side bending. And we will start again by asking about the baseline, same as before. Once we establish a baseline, we'll say, can you sort of slide your hand down your leg, tip, and come back up? How does that change? Does that do anything to this pain? Make it better, worse? Does it stay the same? If it's status quo or better, we will do more than one repetition of that. Okay, so we'll talk about that. And we would do the same thing to the other side. So the last motion that we're going to do for this semester is rotation. There's lots of opportunities to combine motions and test combined motions, and perhaps actually we may even have done that in the test of function, since that's where they're most likely to occur anyway, so that might give us more information. But for rotation, we're going to start again by establishing the baseline, figuring out where the pain is that he's beginning with, and then so that we can see how it changes. So we could compare, just visually looking at, can you just keep your feet planted and turn as far as you can to the right? Look over your shoulder and come on back. Does that do anything to this pain? If it doesn't, I can then also hold his hips so that I can look at more specific motion to the spine. Can you turn to the right again? Go as far as you can and come back. And then, is that better or worse or the same? If it's status quo or better, we could have him do that more than once. Turn to the right, and come back. And then we can talk about, again, how many times to do it. And then once we're done with right rotation, we can do the same thing to left. Okay, so during motion testing, we're going to be looking at a lot of different things. So some of the things we're going to look at is initial alignment, like we would have looked at in tested function also. So we can see if he's in alignment, that his shoulders are over his pelvis, or we can sometimes see what's called a lateral shift, which would be the pelvis to the side in relationship to the shoulders. So in this case, his pelvis is to the left, his shoulders are kind of to the right, and we would call that a right lateral shift. But for now, let's assume that he's in neutral alignment. And then, so as he bends forward, I need to make sure that I'm changing my angles as he's doing more than one, so that I can see if there's smooth movement down. And I also might look at the same thing from the side in order to see. Because sometimes we can see alterations in the quality of movement. We're also trying to examine the quantity as well, though we'll measure that differently later. So sometimes we can see what's called aberrant movements. Whereas they're bending down, they kind of go to the side a little bit. And then they end up back in normal, and then they come back. So I, again, need to make sure that as he's bending forward, can do that again, that I'm making sure I can see from more than one directions. Okay? Turn to the side. So sometimes we might see some like ratchety kind of movement. Can you bend forward? And other times you might see sort of where they have to put their hand on their thigh in order to kind of push themselves back up. There we go. So another thing that we're looking at is trying to make a decision about how many repetitions each movement should be done. So what we're basing it on is the hypothesis we're going in with, and that's part of the issue, so it's going to be very individualized based on the person in front of you. But let's say that this patient has right-sided leg pain, right-sided low back pain, and buttocks pain, and that he often gets pain into his right calf. So, but he doesn't have it at the moment. So we would have him sort of, and it's sitting that brings that on, prolonged sitting, or bending forward. So we ask him to bend after we get the baseline and all that, like we talked about before, and we see what happens. If that does not produce the leg pain, and he still has this, we will have him go through repetitions of it. Can you bend several times forward? If you start to feel that leg pain, then let me know. Otherwise, I want you to go through that motion several times. So it might be that it takes 3 or 4 repetitions, it might be that it takes 15, but we would be trying to test our hypothesis. Assuming that this is not getting so severely uncomfortable that he has to stop, which it might, without ever getting to that. But let's say he does 12, 13 repetitions and he says, oh, now I start to feel that into my calf. That's when we would say, okay, that's enough. I've got a peripheralization phenomenon happen with flexion. Okay. Now I could follow that with extension and see if that extension decreases that calf pain. Okay, so can you put your hands on your hips and arch backwards and come back? Has that done anything to the calf pain? He says no. We have him do several repetitions. Keep going through that, and we see what's happening to the calf pain. And what we want is for it to change location. We want to see, does it come from here, maybe to here, or maybe back to the baseline where it was here. And if we do get that change of location at least to here, then that would be a centralization phenomenon.